Hi, Fact Forward here. We are here to talk about Reproductive Health Awareness Month. As you can see, I have CEO Beth DeSantis with us. We wanted to discuss May and Reproductive Health Awareness Month because people have noticed there's been some name changes in various states. And we really just want to inform people about the purpose and what you can do as an informed citizen to get involved. So, Beth, thanks for hopping on video chat with me. The first question I have for you is organizations across the country are celebrating May differently this year. Can you tell us why that is and what we're doing?
Sure, absolutely. May has traditionally been Teen Pregnancy Prevention Month. Really, it started ever since the 1990s when we really started seeing that in our country, our teen birth rates are much higher than other countries that were very similar to us, and really kind of dug into why that was. And one of the keys was to have an entire month, which was May, dedicated to just increasing awareness. If you're aware of the issue, you're more likely to be willing to talk about it and take steps to mitigate that. So really, May became Teen Pregnancy Prevention Month. And what's happened in the field in the last few years is that a lot of our national partners have really realized that if you look from state to state to state, the sex education in different states varies, and it's very different. And what our national partners are very well aware of is that if they can work with the states as a cohesive body and really help each state identify the sex education needs inside that state and increase those, the offerings within the school systems, that kids really do benefit from that. So our national partners have moved more to a sex ed for all platform because they are really trying to push what it is in the school systems that could become a better education system to give young people the right facts at the right time. Here in South Carolina, what we decided to do was really go after a month to increase awareness about reproductive health for young people. It's not just to us, it's not just sex ed for all. It really is a cohesive movement or cohesive awareness all around increasing reproductive health education, which includes pregnancy prevention, sexually transmitted infection prevention, as well as the HPV vaccine, which helps to decrease cancers later in life for people. So for us, we really moved to a reproductive health awareness month because we want to increase the awareness about all reproductive health for young people, not just the teen pregnancy prevention piece.
Yeah. So you alluded to the purpose of May when it was sort of just beginning in the 90s. What is the purpose of it now? Why are we still doing it? Why is it important?
Right. So it really started in the 1990s because we had such a high rate of teen pregnancy, and we've driven the rate in our state down by 70%. So we've done a lot of really good things. But the problem is in our state that we have high rates of sexually transmitted infection, gonorrhea and chlamydia, namely in our young people. So the risky behaviors haven't necessarily stopped. We've been able to use our messaging to help teens make better choices about getting pregnant or not getting pregnant. But what we haven't been able to do is drive down our sexually transmitted infection rate. So for our young people. So that's why it's really important to us for us to have a reproductive health awareness month. So it's all of reproductive health, not just teen pregnancy prevention, because those STIs, as well as the HPV vaccination, are things that teens also need to know about, and their parents and the trusted adults in their lives need to be aware of. So Reproductive Health Awareness Month is really where we thought would be the right thing for us to do for the month of May. We still do teen pregnancy prevention. We will never leave teen pregnancy prevention, but we really want to incorporate the messages around sexually transmitted infection as well as HPV vaccination, because that together, those three elements are really what makes up reproductive health for our young people.
Yeah. So this month we're really concentrated on supplying our followers, our partners with South Carolina data about what other partners are doing, and basically just providing resources so that communities can learn, become more aware, and share that with their communities, basically.
Right. When a community takes on this kind of endeavor or increases awareness around reproductive health care for young people, It starts at the individual level. You know, every adult usually interacts with young people in some way. So if they can become a person who's open and willing to have those communications with young people about reproductive health and feel comfortable and confident in that, then the teen gets a much better source of information. They actually get the facts instead of relying on Google and the internet and their friends, which they might have the right information, but they might not have all the facts.
Yeah. I'm just sort of thinking because we answered 2 and 3 at the same time.
Of course we did.
I mean, they're all married together, you know. Do you have anything more to say about how somebody can support Reproductive Health Awareness Month?
Sure. So I think the
Oh, wait,
basis.
that was just me asking.
Yeah.
Okay, well, let me redo it then, because that was a little casual.
No, that's fine.
Great. So how might someone support Reproductive Health Awareness Month on their own?
Right. So I think there's so many different things that people can do. The first is to try to, if you're an adult who interacts with young people at whatever level, maybe you're a parent, a coach, a teacher, a counselor, a clinician of some sort, is to familiarize yourself with the facts. If you go to factforward.org, we have all the data and all the statistics that we can possibly put out there. Familiarize yourself with what the facts are. Then, if you have the opportunity, we have more information about age-appropriate messaging as well as evidence-based programs that are out there that can help you arm yourself with the facts. The fact of the matter is that young people want to get the information about reproductive health from their parents and the trusted adults in their life. That's where they want to get the information. But most adults, over 90%, feel very uncomfortable talking about it. And when asked why they're uncomfortable, it's because they feel like they don't have the right information or the right facts. So we at Fact Forward are very cognizant of the fact that we want to be able to help people have the right information at the right time to have really good conversations about love, sex, and relationships with young people so that they make the right decisions at the right time. So factforward.org. The other thing is that you can really work on media ready messages that we've prepared so that you can share those as well. And then not the last, but an additional thing you can do is we do accept donations. And so at Fact Forward, we are a nonprofit and we are always developing new ways of teaching adults how to interact with young people. And so if you're so inclined, a donation to Fact Forward goes a long way in developing new and innovative ways for us to work with adults who work with kids.
Yeah, great. Well, Beth, thank you for the time during quarantine here with me on video and answering some questions for me. If you, the viewer, have any other questions about May that we can answer for you, drop it in the comments below. We'll get to it. We'll give you an answer. And thanks for watching. And Beth, thanks for your time.
Thanks so much, everybody.